Hi everyone, my name is Tammy and I'm a doctor of physical therapy. In this video, we are going to be talking about lower back pain that feels better with side glide movements. Now, if you haven't watched the first video about lower back pain where we do a screening to figure out what movements are better for us, make sure to watch it because it is going to give you a better understanding if the next set of exercises are good for you. The link will be in the description. As always, make sure you read the indications, contraindications, and red flags listed in the description for you. And if you like this video, don't forget to subscribe to our channel. Okay guys, so with this type of back pain, you are experiencing pain on one side of your lower back, going down towards your buttocks, your knee, even down to your ankles or toes. And one thing that you will see is that your body might be curved to one side. So your upper body might be in this position or in this position, and you can't seem to straighten it out. Even when you're sitting, you might be tilted to one side, but you're not even aware that you're doing that. You can't align your body. So when we do our repeated movements, when you bend forward, you're like, oh my God, Tammy, I feel the pain in my lower back. When you go backwards, you're still feeling it. But when you try to do your side glide, which is when you put both hands on your hips and you try to move both hips to one side. Again, you guys, I'm not side bending, I'm gliding my hips to one side. Maybe going to one side reduces your symptoms. Going to the other side might increase your symptoms. Those are the people that need to do these exercises, okay? So the first thing is, if you can, you're gonna stand up tall, feet are hip width apart, push your hips to one side. Now I like to put my hands on my hips because I can kind of guide where my hips are. Then you're gonna do it on the other side. And you're like, okay, going to this side is hurting me. Going to this side is improving my symptoms. I want you to try to incorporate that movement into your routine. About every hour you do 10 of them. Now, let's say your symptoms are really aggravated. You're like, honestly, I can't even go side to side. So maybe we start with a flexion movement. So if you can put your hands on a chair that's stable or your bed, so you're in like a bent over position, and from here, bring your hips to one side. So I'm gonna go to that side that seemed to be reducing my symptoms. Again, meaning it's bringing your pain up towards your glute and your lower back, right? If you do this and you're like, oh no, after the fourth one, I'm feeling numbness below my knee, I'm feeling nerve pain below my knee into my ankle, that's a bad movement for you. Try it on the other side, okay? So again, same movement as we did in standing, but we're doing the movement in a flexion position. Let's say you do 10 of these, you feel better. See if now you can come up a little bit taller and try that movement again, okay? And I'm going to the right, let's say right-sided glide is helping me. I'm going to do this movement 10 times, and eventually I will be able to do it in a standing position, okay? And I'm like, okay, yeah, when I do this, my movement got better, my symptoms are less, and so you know this is a good exercise for you. So that's the progression from a flexion position into a standing position. Another great way of doing this is if you use the wall, okay? So let's say you're in this position, okay? So I'm curved to this side, and as I move this way, I feel better, okay? So what you want to do is you're going to put your hand on the wall. So again, this side is making me feel better, okay? So I'm going to stand, put my hand on the wall, and with my hand, I'm going to push my hips into the wall, okay? So I'm going to show you guys that in the front view. Okay guys, so now I'm going to show you in the side view. You can also see the beautiful background, which is our little office. So what I want you to do is, again, imagine that your hips are tilted to this side, right? You put your hand on the wall, put the other hand on your hips, and push your hips into the wall, right? Can even maybe go closer, and this really gives you a better range. It helps make sure that you know your body's in line, and see how that feels. If this is hurting you and you can't go this way, do it on the other side. Put the other hand on the wall and try to push your hips into the wall. If it's reducing your symptoms, you want to repeat this movement at least 10 times every few hours. until your pain reduces and eventually your lower back will align again. So if you are in this position, eventually it will go into that straight up position. Now that we're done with our standing exercises, we're going to move into the mat exercises. Again, you can do this on your bed as well, but you have to make sure that it's not a super soft mattress. So if you have like a firm mattress, you can also do it on your bed. Okay, so now that you're on your mat, again, we are going to start with flexion of our lumbar spine. So what I want you to do is you're all gonna lie down on your back, okay? Then you're gonna bend both of your knees, bring it to your chest and take it back down and see how that feels. Again, we are going to try to do 10 of these. If it makes your symptoms worse, meaning now your symptoms moving down towards your knee, your ankle, stop the movement. We'll move back into extension exercises, okay? So remember at the beginning, these movements you might not be able to do, right? That's why we're doing the standing glide movements. But again, after a few times, give this a try. Maybe you'll be able to do these movements. Okay, so again, first we are going to start in our extension. So prop on your elbows, relax your belly into the mat, relax your glutes, see how that feels. Hang out here for a few minutes or maybe like 30 seconds to start with. If your symptoms are not getting worse, we are gonna do a press up on our hands. So again, plant your hands down, relax your bum, push your body all the way up, squeeze your shoulder blades back down, relax that glute and go back down. So you're going to repeat this 10 times. Every time you come up, exhale, relax your belly, and you come down. Now, if this is helping you, continue incorporating this into your routine. Again, you do 10 reps every few hours. And now, if it doesn't help you, the next 2 movements that most likely will benefit someone who has this type of issue is to incorporate that side glide into our extension. Meaning, pick up your hips, put it to one side of the room, and then from there, you push up. So the difference between this and a regular press up is that with this, now we're adding that side glide into extension, right? So again, try this a few times and you're like, you know what, Tammy, it's not helping me. I don't feel any reduction in my symptoms. My symptoms are not centralizing. Okay, pick up your hips, try the other side, okay? And then come up. And then maybe you do a few and you're like, you know what, yeah, this side feels a lot better. I feel that the tension is moving up from my ankle to my knee to my lower back. I don't feel the symptoms anymore. Great, so I need to incorporate extensions with a lateral shift into my routine. Now let's say a few weeks go by, your symptoms are reduced, your back is not curved to one side anymore, and basically you have minimum lower back issues, or you actually don't have it at all. What are we going to do to prevent this from ever happening again? Okay, all right guys, I'm going to put a series of exercises in the description for you that will help you with the range of motion of your lumbar spine, strengthening your core and back muscles, your glute muscles, and stretching those tight muscles. But in this video, I'm going to go over some that are really beneficial for those of you who don't have time to look at the rest of the videos. At least I want you to try to do these, okay? One thing I tell you is if you don't try to manage this condition, it will always come back. Right? And then with doing few repetitive movements, you won't be able to get rid of it. Don't forget that, okay? So the first one is we'll do a couple of range of motion exercises. So again, you can do your flexion exercises, okay? You repeat them 10 times, you just bring your knees to your chest. The second one is rotation of the lumbar spine. So again, you bring your knees to your chest, you can go to one side, okay? You repeat this a little, or you can just leave it on the floor. Keep this position for about 30 seconds, and then you're going to repeat it on the other side, okay? Again, you're incorporating your extension exercises that we already did. Now, in terms of stretches, we are going to do a couple here. One is single knee to chest, so one leg is down or bent. You bring the other knee all the way up and towards your chest. You can either hold from behind the knee or on top of the knee, whatever feels better for you, but your neck and your shoulders glued to the floor, okay? You hold for 30 seconds, then you switch to the other side, hold for 30 seconds, and you repeat all the stretches for 30 seconds, repeat 3 times. Then we do a double knee to chest, which is both knees up towards the chest. A lot of people like to go over because you might feel a better stretch, but I like to go under because I just don't want to put pressure on my knees. And then you can go side to side. Great. And the last stretch we do together is one of my favorite stretches. It's a piriformis stretch. Again, I will have a video dedicated just to piriformis stretch in the description for you, but here we'll go over it quickly. So you bring your right ankle over your left knee. You have this window created in between your legs. Bring your hands right through. Interlock your fingers behind your left knee. As you push your left hamstring into your chest with your elbow, push your right away. Now, if this is too hard, again, you guys refer to that video. I will show you modifications. You hold it for 30 seconds, repeat 3 times. And then you do it on the other side. And for a strengthening exercise, we are going to do a couple of isometric exercises. The first one is you bring one hand up, put it on the opposite knee. As you press up with your knee, you push down with your hand and you resist 50% of your maximum strength, okay? 1, 2, 3, 4, 5, relax. 1, 2, 3, 4, 5, relax. So you do it on the other side now, and all of these you're holding 5 seconds. Repeat 3 sets of 10, okay? The second exercise we are going to do is going to help with our lower back strengthening. We are going to incorporate bridges into our movement. So you're going to tilt your pelvic in so your back is glued to the floor. Have your hands down. Feet and knees are hip width apart. Squeeze your bum, come all the way up. Hold it for 5 seconds. And relax, go all the way back down. And again, up. Hold for 5 seconds. And go all the way down. Okay, you guys, I hope that the exercises we went over in this episode were beneficial for you. Again, this condition can be caused for a number of different reasons. Sometimes you might just wake up with it. Sometimes it can be because of a weakness that we have in our core and a certain weird movement that we did. Whatever the reason is, there is pressure on that nerve. Right? So we try to do repeated movements to try to alleviate that pressure on the nerve. Once the nerve calms down and it's healthy again, then you need to make sure to incorporate exercises, stretches, strengthening exercises to help the overall well-being of your muscles, so episodes like this doesn't happen to you. As always, if you have any questions, make sure to leave a comment for me. And if you liked the video, don't forget to like, share, and subscribe to our channel.